Perfect. So again, just want to welcome everybody here today. As I mentioned, we are very, very excited to have the Neurology Clinic with us as part of our annual series, our bi-monthly series with the Jim Pattison Lunch and Learns. I want to extend a heartfelt welcome to all of you and thank you for joining us over your lunch hour. We are a quick 30 minutes today. I do want to extend my gratitude as a territory welcome that I personally am calling in from the lands that are colonially known as Cloverdale, but historically on the ancestral and traditional territories of the Coast Salish peoples. And for me in particular, that includes the Kwantlen, Semiahmoo, Tsawwassen, Katzie, Kwekliam, Quakut, and numerous Dolo First Nations. And I know a lot of us sit through these Zoom meetings and we do territory recognitions all the time. But for me, along my own learning journey, it has been a reflection of deep gratitude that I am able to be here despite being an uninvited guest. So very pleased to be on this land. In terms of some housekeeping items, some of you have sat with us through these lunch and learns before, so this shouldn't be new, but just in case, again, we are recording, so if you don't want your image recorded, please turn your camera off. But if you are comfortable, we invite you to turn your camera on and say hello in the chat to some of your colleagues today. When you are not speaking, we do invite you to continue having yourself on mute so that we can minimize any background noise. The chat box is a great spot for you to ask your questions. I'll be monitoring the chat, and as we get towards the end of the session, there will be an opportunity for you to either unmute and ask, or we'll just ask the question through the chat as well. And we'll be compiling all of the Q&As at the end, and a document will go out in the next couple of weeks to answer and address any questions we may not have had a chance to get to. Your CME credits will be sent out to you at the completion of the evaluation at the end of the session today, and the evaluation link, as always, will be put into the chat box. And now, without further ado, I just would like to hand over the conversation today to the Jim Pattison Group, the Neurology Clinic, with Dr. Dana Abel-Salm and Mariah Jones. So over to you, fine ladies. We're looking forward to the conversation today.
Thanks so much, April. Welcome, everybody. Thanks for joining us today. As April mentioned, I'm Mariah Jones. I'm the manager for the Neurology Clinic at Jim Pattison. And just to give you guys some of the objectives of our presentation, it is a little bit brief, but we'll try and keep it concise. So we're just going to do a general neurology clinic service overview, what we offer. The Headache Toolkit will give you a little bit about the resource itself. We'll get into what the toolkit is used for and where you can find it. And then we'll talk a little bit about the types of headaches and when to refer to the clinic. Looking at the neurology clinic referral, the inclusion and exclusion criteria is something that we'll get into a little bit as well. And Dr. Abel-Salm will also mention the RACE, the rapid access, how to do that and where to find it. And as well, we'll look at the pathways with the clinic contact info and our location. Next slide. Sorry, I muted myself just right at time. For those of you that don't know, the Jim Pattison Neurology Clinic is made up of several streams. So we have the movement disorder, which is providing diagnosis and management for illnesses, for example, Parkinson's disease, tremors, tics, or dystonia or chorea. We've got the epilepsy stream, and we offer expertise in the diagnosis and management of seizures and epilepsy, as well as providing neurodiagnostics like EEGs. We have our neuromuscular disorder and autonomic program, which assesses muscles and peripheral nerve disorders. And we offer advanced testing with the EMG and nerve conduction studies. We also have a tilt table for testing and quantitative sweat analysis and sensory testing available. The other stream we've got is neuro-ophthalmology, which provides diagnosis and management of visual loss, double vision, irregular eye movements, and pupillary abnormalities that are caused by conditions such as a stroke or autoimmune conditions and cancers or infections. Then we have our urgent neurology stream, which supports a lot of the local doctors and emerge and community physicians. And those will be more for timely review of cases that are, again, quite urgent. And then again, we've got neurodiagnostics, outpatient EEGs and EMGs done at Jim Pattison, and the inpatient and pediatrics are done on site at Surrey. And last but not least is our stroke prevention clinic, where we have rapid access for outpatient preventative treatments when they follow a discharge from acute care due to recent TIAs or transient ischemic attacks. And then this presentation that we'll be talking about today will specifically be covering information related to our clinic's headache service. So for patients with atypical or refractory headaches, specifically, we're going to give you some resources that are available to the community in our headache toolkit. And I'm going to hand it over. I'd like to introduce our wonderful Dr. Dana Abu-Alsam. She will talk to you about the headache toolkit.
Hi, everybody. Can you guys hear me and see me okay? If so, I will talk to you guys a little bit about the headache. I'm a new neurologist to the area. I work all over Fraser Health, and I'm mainly involved in general neurology. I also work in providing stroke prevention clinic guidance. I have an interest in movement disorders, so you might also encounter me in a movement disorders type of setting. General neurology, though, is my passion, and I do a lot of migraine in the community as well as in Fraser Health facilities. So in my fairly short time practicing in Fraser Health, I think I've identified a few areas of an inefficiency in our ability to manage patients with headache. As you all might know, our wait list, especially for general and urgent neurology at Jim Pattison, as well as elsewhere within the province, to be quite honest, for access to urgent as well as routine neurology care is quite limited. And due to the fact that previously there was a headache tool that is no longer easily accessible to primary health care providers as well as emergency care physicians, I thought it would be important for us to reinitiate that movement and make it so that people have access to the right tools to make the diagnosis, manage patients, and prepare them for when they actually do need a neurologist, which is, I would characterize it as advanced, chronic, and complicated headache care. Headache is a very, very common disorder, and migraine is the most common disorder worldwide. So it's very important that we get that under control. Not every single headache actually requires neurology intervention. And in fact, I would say the vast majority of headaches do not. So with the headache toolkit, also referred to as the headache pathway, we are aiming to do that. There will be algorithms and guidelines for you to help you first come to the correct diagnosis. And then there will be guidance about when to investigate, who to investigate, what to order, and how you can get assistance in that first phase of the process of assessing a headache. Then there is guidance about what to do for prevention, as well as for abortive therapy. And then finally, how to actually engage patients in managing headache disorders, because lifestyle interventions are a huge piece of headache management, and in fact can be a huge pillar in that management. We are going to make the headache tool available through various avenues for you. The first of all is going to be available for all medical staff through the website here, and this is the Fraser Health website. When you are going to click on medicalstaff.fraser health, and you'll find it under clinical resources, it will be under it will be under the Jim Pattison clinics and services form, and it will be under the neurology referral forms. It will not be a specific or unique new referral form as far as I understand, but there will be resources there about who actually needs a referral and all of the resources that you will need to diagnose and manage headaches on your own. The other thing that I have learned in this process of creating all of these materials is that Pathways is such an important service for many practitioners in primary care, community, even emergency services. So we are endeavoring to actually make all of the materials also available through Pathways. with exclusion and inclusion criteria, so that we can best assist you. The other thing that I'm working with Pathways on is actually initiating a sort of send a message option through Pathways, so that we can also have another avenue to review cases or answer questions as they come up. So I'm going to preview the material because I'm very happy to have sort of completed most of it, and it's going to be in PDF form. The material is going to look something like this. Initially, the first topic at hand will be the indications for referral. So there you will find a list of what sort of headaches actually do require neurologist involvement and what sort of information should be included in the referral, in addition to what the clinic is aiming to hopefully manage in the community with the support of neurology, instead of having the patient wait as long as they have been waiting for their referrals. So that would be the first step. The second step will be the screen, which is identifying those patients that require more urgent assessment, as well as require possibly some workup. And that's going to be through the red flags document. This is succinct, available in the resources. And also in the next page of that document, there's details about what to order and for what. That will provide a lot of guidance for patients, physicians, about what to order for what type of headache, so that they find right in front of them what they need. Next is going to be the migraine diagnosis document. We know that over 80% of patients who are presenting with fairly straightforward migraines have received a misdiagnosis or an incorrect diagnosis when they started having their headaches. Most frequently, the two diagnoses are in about a 50-50 split, is a tension headache, so a regular stress type headache, or the second sort of misdiagnosis is actually a sinus headache. So this document is aiming to walk the primary care provider through every single step of the diagnosis. It mentions the criteria. There is tools for making the diagnosis, including screening tests, and also some clues that could point you towards something different. Aura is one of the features of migraine headaches, and it's actually a commonly confusing symptom for many practitioners. So there's also tools to actually identify whether or not a patient is experiencing an aura within that document. Next, we're going to approach the acute management document, and this has a validated patient type of approach, which allows patients to actually titrate the management of their headaches based on the severity. This is the traffic lights that you're seeing here, and also a summarized version of that can be quickly accessed or hung in clinics if that's something that you encounter on a frequent basis. After we've managed things acutely, then we get into the preventative management and the principles of the preventative management. Those principles are going to be very important because we know that prevention is an area that we completely sometimes really miss the ball with these patients, and it's really important to prevent, because actually data has shown that when we don't prevent patient headaches, they do turn into chronic migraines, and those patients have massive overuse of healthcare resources that are for headache as well as for other reasons. So it's important to intervene early in this population. There's going to be an algorithm that simplifies all of that with highlighted recommended medications to start with, doses, side effects, who to pick this medication for and why, and then finally some recommendations for lifestyle, which are very pivotal. There's going to be a doctor version of this recommendations of lifestyle, which actually goes into the research of why what lifestyle interventions have benefit for patients with migraine, as well as a patient version of that is more straightforward and easy to read and will come in a handout that's easy to give out. Finally, we do ask that for patients that are referred to our clinic that we complete a headache questionnaire. This headache questionnaire is not only important in correctly identifying the diagnosis and simplifying the visit, but it also is really important because we know that for insurance providers, when we do not provide the impact of headaches, many medications are not covered, and this headache questionnaire will facilitate that. Additionally, for people who are seeing patients in the community and have headaches, this questionnaire will also serve as your history taking tool that will simplify your ability to take the history from the patient if you're not sure about what to ask or how to hone in on your diagnosis. It provides screening for some of the red flags and can simplify your history taking overall. And it would be a very valuable tool for you as well as for the patient, as well as for our referrals. All right, so just to go through criteria quickly, we are now going to be limiting some of the headaches that we see in our specialized setting of Jim Pattison Neurology Clinic. So we'll only be seeing migraines when the patient has failed at least 2 abortive therapies, as well as 2 preventative treatments. And by that, we mean the non-specific oral preventative medications that can easily be found in the document. We'll be seeing recurrent thunderclap headache after more insidious etiologies have been ruled out, which includes the subarachnoid headache, and that information can be found in the red flags document. If their headache has red flags and all, again, insidious etiologies have been ruled out, we would be happy to see those headaches as well. And those headaches, we would recommend actually reviewing them with on-call neurology to make sure that nothing is being missed and that the imaging is appropriately being reviewed, because we have seen some cases where findings exist on imaging, but they're actually missed on the report. And then finally, trigeminal autonomic cephalalgias. These are special headache types that include things like cluster headache, paroxysmal hemicrania, hemicrania continua, headaches known as SUNA, as SUNCT. These are really very rare but very debilitating headache disorders that require early intervention. Okay. Next, I'm going to tell you why the headache tool is going to be important, because we have noticed that patients and practitioners are waiting for a very long time for their referrals, and that could be up to 2 years. Furthermore, there's frustration from, and rightly so, from the primary care perspective, that they're not getting the answers that they need for caring for their patients. And as I mentioned, the chronification and transformation of migraine into a more chronic, more debilitating disorder is definitely something that's been shown in research. It will reduce inappropriate referrals from the primary care setting, which can be managed in a primary care setting and provide better patient satisfaction. And then it will enable us to get to your more urgent and varied neurological complaints that come through to the neurology clinic, because we've also noticed that our urgent patients are not getting seen in a timely manner. So all of that is meant to support what can be managed in the community and also triage what needs to be seen by a neurologist. All right, so for the referral criteria, we would like you to include a clinical history, the red flag screening, which will be available through the resources, and there's a complete document with investigations as mentioned, a list of medications, particularly what has already been tried and what had been failed or been found to cause intolerance. So that's the medication trials and ongoing medications. Occasionally, people can be on medications that trigger headaches, such as overused medications, for example, or overusing nitroglycerin. So that's going to be important. If this person has been seen for this problem before or been seen by a neurologist, we'd like that information included. And if there was any neurodiagnostic studies that were ordered, we definitely like that. Finally, the completed headache questionnaire, I think, is going to be a fantastic tool for practitioners as well as patients. It'll clarify the diagnosis. It'll help us understand the impact. And if we want to initiate advanced therapies such as the GPANTs or the CGRP antagonist antibodies, we need to understand what is the frequency, what is the impact, because all of those go into the considerations of both pharmacare and as well as insurance. All right. And some of the inappropriate referrals to this clinic, which may just require a review of the headache toolkit criteria, as well as the headache toolkit available resources include tension headaches. Those are the simple sort of stress headaches where patients are not disabled and can be easily managed with over-the-counter medications and very simple preventatives and lifestyle alterations. Migraines that are, fairly brand new, naive to any and all therapies, intracranial hypertension or idiopathic intracranial hypertension. Unfortunately, that's something that's often overcalled in imaging and does require sort of a different assessment from our complex migraine or complex headache sort of pathway, and that typically should go to neuro-ophthalmology. Post-traumatic headaches, as there are many centers for concussion and TBI that have the dedicated allied health resources to facilitate care for these patients, and then re-referrals, because that should actually return to the initial neurologist who has been involved in a patient's care. It ensures continuity and it gives the patient an idea about where they are in their management, in addition to the fact that they obviously have all of those records. I want to plug the RACE app because it is severely underused in our region. It can provide a lot of diagnostic capabilities to the patient, to the primary care provider in the community. I understand it's a little bit labor intensive entering all of the patient information, but it can save you as well as the patient months and months of waiting for a routine referral. So I would really like to plug in the RACE app. And as I mentioned, hopefully we're working with Pathways on making a sort of messaging feature that will be answered on a sort of maybe once or twice weekly basis to provide guidance. But the RACE app is a fantastic tool to get the answers you need within about 2 hours, and typically within business hours. You will get a direct call. If there's any uncertainty, you provide the patient information and imaging can be reviewed if it's already done, and it can save you as well as the patient months of waiting. So I would highly request that that we actually start using this more often, because it certainly has its role in managing these referrals rather than waiting and enduring the patient dissatisfaction. Finally, I'd like to hopefully once this is completely launched, we'll be able to have this on Pathways and be a part of the neurology clinics in Jim Pattison. So this is where we're located, and our contact information and business hours. And as I mentioned, we're working really hard with the Pathways team on making all of this information available to you. So I'm just going to say thank you and maybe open it up for some questions that I can answer.
There aren't any questions in the chat just yet, but
Okay.
I'll invite anyone from the audience, if you have a question, to either you can unmute yourself, or you can raise your Zoom hand, or you can pop it into the chat. Now is a great time. We've got a few minutes left, and I know the team are happy to take your questions. Generally speaking, silence is a good sign. That means you've answered all the questions.
Well, hopefully, we were trying to make this process a lot more seamless. I definitely understand that for practitioners and even, our support staff, migraine as well as headaches can be quite a headache, pardon the pun. However, and access to neurology can also be something that is a bit of a black box. But hopefully with the availability of all of the material, we'll be able to streamline the process and make it easier for people to access the care that they need in a timely manner and avoid some of the long wait times that we've been experiencing in the past. This will also hopefully fairly soon go to emergency care practitioners, because there is actually a section within the documents for therapies that can be done in an emergent setting. So I am hoping that, within Surrey-North Delta, we have a bit of a unified front on being able to handle most of these complaints in the community, but certainly allow the people who would definitely benefit from neurology to access that timely care instead of waiting for a long time for it.
It's exciting stuff that's coming. So I've popped in for anybody who's curious, I've put into the chat the link for the evaluation. There's just a few small questions that'll help us make sure that you guys got out of the session what you were looking to get out of it, but also helps us design some of our upcoming sessions. The next one will be in a couple of months, so please keep an eye open for the invitation. And if there are no further questions, I just want to say a big thank you to the Jim Pattison Neurology team, to Dr. Dana Abu-Alsam, and to Mariah Jones for taking time out of your day. We will be sending out a compilation of the slide deck that you saw today, plus any links and resources that Dr. Dana mentioned. And if you have other questions, please feel free to reach out to one of us at the division, and I'm happy to connect you with the team at the Neurology Clinic, and we can, put you guys in touch and stay connected to one another. So thanks, everyone. We appreciate your time. You're free to leave once you've completed your evaluation, and thanks for the day.
Thanks for having us. Have a great day,
Really nice
everyone.
meeting you all.